Hello, my name's Emily. I'm the Network Manager for the Closing the Gap Network, and I wanted to talk to you today about our plans for the network in light of the current Covid-19 pandemic and what we're planning to do. So today I'm going to talk to you about our Closing the Gap cohort and some of the plans that we have for that. But I'm hoping that we'll be able to launch over the next few weeks a series of videos and podcasts and written blogs where members of the network are talking about their plans and what they've been thinking of doing in light of the current situation. So to go back to the cohort and the plans we have for the cohort, what we really want to understand is how people with SMI are experiencing the current pandemic, and with particular reference to isolation and social distancing, and see how that's affecting them. So one of the things that we're particularly concerned about is the fact that we think that people with SMI are often less likely to be digitally connected than people without SMI, and so therefore at risk of experiencing the digital divide. And we want to understand if people indeed are experiencing that and how they're experiencing it and what the impacts are on their physical and mental health. For example, are people with SMI finding it more difficult to get food shopping because a lot of things have gone online, and if you're not digitally connected, then it's more difficult to access deliveries of shopping, for example. Or, if people are unable to contact friends via Zoom, which seems to be a thing that people are using a lot to talk to each other, or other digital means of communication, then that could be another potential factor in either making people feel better or making people feel worse. We also wanted to understand about whether, if access to medical appointments is going online, whether that is affecting people's ability to access healthcare services. So it's all these kind of things that we want to understand as to if people with SMI are at risk of being the digital divide, and if they are at risk, then what impact is that having on them. So we're going to do a survey of people and asking them about their experiences, and we also want to do some qualitative interviews where we can ask people more detailed information about how they've experienced the current isolation, lockdown, and what could have helped them to feel better, or what is indeed helping them to feel better, and what's perhaps not been as good for them. So those are our plans for the cohort. Thank you for watching. Goodbye.